Hi, Dr. Reagan Robertson, CCO of Productive Dentist Academy here, and I have a question for you. Are you finding it hard to get your team aligned to your vision, but you know you deserve growth just like everybody else? That's why we've created the PDA Productivity Workshop. For nearly 20 years, PDA workshops have helped dentists just like you align their teams, get control of scheduling, and create productive practices that they love walking into every day. Just imagine how you will feel when you know your schedule is productive, your systems are humming, and your team is aligned to your vision. It's simple, but it's not necessarily easy. We can help. Visit productivedentist.com/workshop. That's productivedentist.com/workshop to secure your seats now.
Where do they have their crowns done? And this is what I talk to patients about when they actually get in the chair. They said, well, you guys are out of network. It's more expensive. But Bob, let me explain to you why insurance doesn't really work in dentistry. It's not medical insurance. Medical insurance is going to cover, 80% of everything up to $5,000 or $10,000, and then they cover 100% of the rest. Dentistry only has had a $1,500 limit like yours for the last 40 years. It hasn't changed. So as dentistry prices have gone up, actually the benefits of insurance have kind of gone down.
Hello everyone, this is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way, it's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Hi, my name is Dr. Bruce Baird with the Productive Dentist Podcast. Good morning. Today's podcast, I am going to kind of elaborate a little bit on a question that was sent to me from a dentist in Dubai. And they said towards the end of one of our previous shows that you talked to patients about insurance and particularly about being out of network and why that costs them more. Would you be prepared to elaborate on this subject on a future show? And yes, I'm going to do that today. The dentist said that they find it hard subject to tackle, and I'd love to know how to do it. I would love to talk about that because it is difficult. One of the things when you start talking about to a patient, and it's almost the first thing that comes out of their mouth is, oh, well, I have insurance. Well, what will my insurance cover? And they bring that topic up. What about my insurance? And years ago, Imtiaz Manji and I have been friends. He's a guy that kind of started Spear and started a lot of things. But one of his deals that he talked about was, and kind of taught me, is I'd say, Bob, I totally understand insurance is very important, but let's pretend this is your insurance. And I would hold up a piece of paper and I would say, let's put that over here right now. I'm so glad you have insurance, but let's talk about kind of what's going on in your mouth first. And I think that that's critical, is to separate insurance from the patient's mouth, if you will. It is something that is extremely important because patients ask that question because they just don't know any other questions to ask. I mean, it's kind of crazy. They don't know what else to say. So when you're, except I got insurance. So tell me how much my insurance is going to cover, because they believe that their insurance is going to cover everything. But what about folks that call up your office and say, I want to, do you guys take my insurance? And absolutely, we take your insurance. We're a non-restricted provider. And what does that mean? And our front desk knows to say that. Oh, we're an unrestricted provider. We take all insurance. Now, we may be out of network with yours, but we'll explain to you everything that needs to be done before we do any dentistry. And we'll help you. We have some great ways, great payment plans. We have great ways for you to get your dentistry done. And, the other thing about dentistry is, there are different kinds of dentistry. The PPO driven practice that's getting a 40 to 50% discount on their fees. I promise you, they're not using the same lab that you are. They're certainly not using the same lab that I am. Why? Because there's no way that they could turn a profit and do that. They're writing off an enormous amount. So where do they have their crowns done? And this is what I talk to patients about when they actually get in the chair. They said, well, you guys are out of network. It's more expensive. But Bob, let me explain to you why insurance doesn't really work in dentistry. It's not medical insurance. Medical insurance is going to cover, 80% of everything up to $5,000 or $10,000, and then they cover 100% of the rest. Dentistry only has had a $1,500 limit like yours for the last 40 years. It hasn't changed. So as dentistry prices have gone up, actually the benefits of insurance have kind of gone down. Today, when I first started in dentistry, a crown was $250. Today, a crown's $1,500 to $2,000. So your $1,500 insurance is not going to effectively help you the same way it would years ago. Does that make sense? And when I say, does that make sense? I am saying that because I want a response from the patient. I want them to go, oh, yeah, I understand. Or they'll say, well, I just really want to use my insurance. I say, oh, we'll use your insurance. We'll use your whole $1,500. Don't worry. Whether you're in network or out of network, we will make sure you use your insurance. So you're going to get that benefit. And in talking to patients, I try to explain the difference in the types of dentistry that's done. And especially if they want to keep the conversation going, which sometimes they do. They want to talk more about it. They want to keep this conversation going about their insurance. Remember, I'm going to set it on the side over here, and I'm going to say, let's just take a look at the mouth. And we'll look at the mouth, and our treatment plan might be $3,000. That's not a very big treatment plan. That's a couple crowns. Or it might be $12,000. Understanding that the patient's not expecting anything and just going in and saying, you need $13,000 worth of dentistry, insurance, patients will run. They will leave quickly. And what's important is to be able to explain to them the differences, because they'll say, well, I'm supposed to go to these dentists to get this work done. And I'll say, there's a lot of good dentists that do dentistry, and they're really large PPO practices. And there are actually some good dentists in Mexico that trained in the U.S., but that doesn't mean that I'm going to go there unless I know where they're sending their lab work to. And that's not something, Bob, you should know, but if they're reducing their fees 40%, where do you think they're having their crowns done? They're probably sending them to China to be done for $15, whereas my lab is doing it for, $180. Does that make sense, Bob? And they go, yeah, I didn't realize that. Yep. So this is something where when they're working with you on an ongoing basis, I'm going to be working with you. We're going to always let you know what is it that needs to be done, and how much your insurance is going to cover. Again, I don't worry about pre-estimates. I don't worry about any of that stuff. Why? Because my average treatment plan, I'm not afraid to tell a patient what they need. And that's something really important to say. I basically ask permission to look at a patient comprehensively. And what do I mean by that? Well, I'll go, hey, Bob, listen, your insurance is over here, but if it's okay, and I know that this one tooth is really bothering you, but if it's okay, I'd like to get some x-rays of all the teeth, or we've already gotten them. And I want to review kind of what's going on in your mouth totally. Because would that be okay if I'm just going to look around and just kind of give you some ideas about what's possible? Oh, sure, Doc. Yeah, go ahead. I've never had anybody say no because it's the way you ask. Would it be okay? I just want to kind of look around because fixing this one tooth, there may be some other things that are affecting that. The gums sometimes will affect that. The there's lots of things. And so I want to be able to look at your mouth comprehensively, and then we'll come up with a game plan. Does that sound good? Yeah, it sounds great, Doc. Okay. So I've switched the conversation from insurance to overall health. Let's see what's going on in your mouth. That gives me an idea of what's going on. And let's say I find 5 or 6 more things, and I find gum issues and everything else. I come back to that patient with, you may or may not have known this, probably already knew it, that you had a lot more work that needed to be done besides that one tooth. Well, yeah, I'm missing this tooth and this one's broken down here, but I was kind of wanting to get this one fixed. Absolutely, totally understand, Bob, but what I don't want us to do is to waste money. And it looks as though you've lost almost all the bone around this one tooth that's broken. And the bacteria that are around that's stuff that's going to affect the rest of your body. It can affect your heart. It can have an increased risk of Alzheimer's, diabetes. There's a lot of things that go into this. The mouth is not a separate thing. It's connected to the rest of your body. And we found that, there are a lot of correlations to disease and other things that are going on in the mouth. So my suggestion is this, we'll get this tooth fixed. In fact, I'm just going to patch it because it's rough right now. And so I'm just going to kind of patch it up. I'm not going to charge you anything. I just want to get it kind of stable for a little bit. But then I'm going to recommend that we do, first, let's get these gums healthy. And we've got a way to do that. We use a laser. We actually use a laser that can actually help new bone grow and can get rid of these bacteria and give you a much better chance of long-term success. It's kind of frustrating, isn't it? When you get dentistry done and it fails. He goes, yeah, I've been doing that my whole life. I said, well, let's get a plan together. Do you know why this tooth is breaking like this? And I go into our risk factor conversations, which you can go back and listen to other podcasts about our risk factors, because what I want to do is by going through these risk factors with the patient, I want them to understand that, first of all, it's not my problem. It's their problem. They have something going on. I am now a consultant for them. I'm not a dentist trying to do a crown. I just don't care about that. I don't want to do a crown on somebody if I think it's going to fail in the next 3 years, or the tooth's going to fail. What I want to do is give them an overall picture of what their oral health is, whether they do it or not. A couple of podcasts, I talked about having a healthy new patient flow. That's why I have a healthy new patient flow. That's why I market, so that I can tell people what they need, what they listen to what they want, and then deliver for them, and I want to do it in such a way that their dentistry, in my opinion, all our dentistry, it should have a chance to last the rest of their life. But if they're drinking Dr. Pepper all day long, I want to explain to them why Dr. Pepper means they have to keep coming back, or Mountain Dew. They have to keep coming back to see me, and it becomes more and more expensive, and it's more costly. And that's going to continue. It's going to continue if we don't follow a protocol to get you healthy. Does that make sense? And I'll ask them that, does that make sense? And I'm asking you guys, does that make sense? Because you don't want to just jump in and say you need $12,000 worth of work. And remember, I always do a ballpark estimate. Bob, I know you probably already knew this, but you have $14,000 worth of work. And they're only going to say one of 3 things. Yeah, I knew it was a lot. 2, I didn't know it was that much. Or they're going to say, there's no way in hell I can do that. Well, that's okay. I want to know which 3 are they. If they say, yeah, I knew it was a lot, that means let's go to work. If they say, well, I didn't know it was that much, I'll say, well, Bob, how much do you think it was going to be? Well, I didn't think it'd be 12. I thought it might be 7 or 8,000. Oh, good. Well, you can use that as a down payment, and we'll work out some convenient monthly payments on the rest. And then if they say there's no way in hell I can do it, I said, I totally understand, Bob. Let's do this. Let's just step back a little bit, and let's look at what things we have to do. Let's get your gums healthy. That's going to help you. Let's get you quit drinking the Dr. Pepper. Let's get you in on a regular recare. Let's fix this one tooth that has an abscess, because that is affecting your body. Let's go through a protocol. Let's do it the right way, because otherwise you're going to be wasting your money. And I don't want you to do that here. Does that make sense? So anyway, I hope you guys have enjoyed today's podcast. Send me questions. This came from, like I say, a question from a dentist in Dubai, Dr. Sharp. So thanks, Jeffrey. Send me some more questions. I love it.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.